Good afternoon. You are welcome to HAE 402, Lesson 1 on Acute Myeloid Leukemia. So, what are the learning objectives? We want to learn about the pathophysiology of AML, how it comes about, the clinical presentation of patients with AML. We'll learn how to make a diagnosis of AML and learn how patients with AML are treated. So generally, the etiology of AML. AML comes about because of abnormality in the genes. There are chromosomal translocations and genetic abnormalities that bring about the aberrations that lead to the malignant myeloid cells that are developed. And these cells proliferate in the bone marrow, and at the end of the day, what they cause is anemia and they disrupt hemopoiesis. This brings about the clinical features that we see in patients that have AML. It's as a result of bone marrow suppression. So they will have features of anemia like weakness, dizziness, pallor, and so on. They'll have features of neutropenia, which classically presents with fever, and then they'll have features of bleeding because of thrombocytopenia. How do we make a diagnosis? For us to make a diagnosis, there has to be a blast count of 20% and above, either in the peripheral blood and or bone marrow. There are other diagnostic tests that can be done, including cytogenetics and immunophenotyping. And then how do we treat these patients? The major chemotherapy regimen that is used is the use of DA, daunorubicin and Ara-C. Thank you. We'll now take your questions and comments.